I'm going to be presenting a research abstract over enhancing maternal care using intradisciplinary education to reduce complications in East Texas. My name is April Walnoffer. I'm a PGY3 internal medicine resident at Christus Health in Longview, Texas. So maternal and obstetric care has continued to be a concern for the state of Texas. The state of Texas is ranked 38 in the nation for maternal mortality. And this is something that's even worse in the East Texas region. A lot of this is from higher rates of chronic conditions that are not being managed simply because of either disparities or limited access to care. So being able to recognize these hypertensive disorders in pregnancy was something we found of utmost importance for an internal medicine residency. So we focused our research on doing simulation sessions with interdisciplinary sessions where we recognize and address these complications such as hypertension and preeclampsia. Our data that we analyzed was from October of 2021 to October of 2023. Our intervention was conducted in October of 2022. If you look at this graph here, it shows our time frame that we're looking at. The intervention that took place in the beginning of October of 2022 included an intradisciplinary didactic session, including resident nurses and internal medicine resident physicians. This included didactic training on hypertension in pregnancy and the complications, including preeclampsia with severe features, and eclampsia. And then there was simulation sessions as well. We analyzed the data before and after this. We first looked at the total sum of gestational hypertension, preeclampsia, and preeclampsia with severe features, which is shown in this blue line, the light blue line. There was no significant change. The rates of gestational hypertension and preeclampsia shown in the dark blue line, there was no significant change before and after the intervention. The rates of preeclampsia with severe features is shown in this pink line. There was a significant change in the diagnosis with a p-value less than 0.05 from before and after the intervention. So we noticed ahead of time that the rates of preeclampsia and gestational hypertension were stable and unchanged. However, maternal complications continued to increase. So there was concern that there might have been lack of recognition of some of these hypertensive disorders in pregnancy. Our finding of an increase of preeclampsia with severe features diagnosis can maybe help contribute to improvement of maternal morbidity and mortality. There was no change in diagnosis of gestational hypertension and preeclampsia, which we see as an area of opportunity for our upcoming simulations. This study does show the importance of continuous education, using simulation-based training to improve outcomes, especially for maternal care with the burden of hypertensive disorders in pregnancy, particularly in our region. Thank you so much.